Hello, my name is Adam. This is my BSN205 sterile dressing change submission video. For this, I need a few things. One of them is normally I would use like actual hand hygiene, washing my hands appropriately, but I'm just going to use this hand sanitizer for the sake of this scenario and for the sake of time. Some sterile gloves, some regular clean gloves, a dry clean gauze, a transparent tape. And then on the wound of the patient, the simulated patient, I have a large bandage that I put on there, and we're going to just kind of simulate that this person came in from the ER, they misappropriately placed the bandage on their continuously increasing wound size, so we're going to change that and appropriately dress that with a transparent bandage. That way it'll allow us to actually see any progression or regression of that wound without actually having to take it off all the time. So what I would normally do is go introduce myself to the patient, verify their name and their date of birth, make sure that I have the right person, and then ask if they have any questions and explain the procedure to them. In this case, the procedure is going to be a sterile dressing change on that wound. While we're changing the dressing, I'm also going to palpate around it and inspect for any signs of extra infections, any granulations that might be occurring, or anything within the wound that might be something that the provider would want to know. So, introduce myself, and I already verified with this patient, so I'm going to wash my hands, but remember, we're just pretending. And then also for this, I need a biohazard bag. In my kit, I was not provided with one, so I'm just going to pretend and use my biohazard bag as my future of nursing bag. So it's just my pretend bag, but it's going to be my biohazard bag for this simulation. So I washed my hands. I'm going to put my clean gloves on. And then I'm going to actually move this a little bit so you can see. And then I'm going to want to use the wound, and I'm going to go parallel to that when I'm taking it off of the patient's skin, and I'd be going across or with the direction of hair growth. So we would pretend that maybe their hair was growing, going that way. And I'd want to take that dressing off, peeling parallel to it, not perpendicular, because then we would risk increasing the size of the wound. And then taking that dressing off, putting it away. And then I would want to just inspect this wound a little bit and see if there's any increased redness or tenderness around when I'm palpating around the edges of the wound. It looks pretty normal, aside from looking like it probably hurts. So then I would want to take my gloves off, put those in my biohazard too, and then I would want to perform hand hygiene again. And remember, I would have normally actually washed my hands, but pretending using hand sanitizer for the sake of this video and for the sake of time. And then I would be putting on some sterile gloves. I had some other sterile gloves because I was kind of afraid that the ones that were provided would not fit. So here we are, hopefully with some ones that will fit me a little bit better. These ones don't really fit all too great either, but what are you gonna do? Ideally, in a clinical setting, I would have more than just size 7 sterile gloves that I could actually fit into, because as you can see, this is quite the struggle for me, so give me a little bit of grace. Alright, I'm going to actually just non-sterilely move the camera here. And then I would use these swab sticks that I would have had in the kit and open, and this would be, I wouldn't be using alcohol, so this would be a saline swab stick, and I'd be just swabbing and cleaning the outside edges and throwing those into my biohazard bag. And noting for any extra drainage or extra blood or any pain that would be potentially occurring when we were doing any of this dressing change care here. And so if that was actual real saline, that would be a little bit on the wet side, and I would want to make sure that I had that properly dried beforehand. So I'm just going to like very gently pat the applied area with a sterile or with a clean gauze. That way it's nice and dry. And then I'm taking my tape, and I'm just going to carefully apply it to the patient here. And I would use my initials where it says initials, date, and gauze, but I don't have a pen that was provided, so I would just, AJR 1031, and it would have been at 3:20 p.m. on a Sunday. I would also want to make sure that if I was giving a shift change that I reported that I changed this in that regard as well. And then I want to make sure that I take my gloves off, make sure my patient's comfortable, throw those in the biohazard, perform hand hygiene, and like I said, document all of the changes and interventions that I performed. Thank you very much.